Okay, so this is our new PetMAP Graphic II, and the on button is on the side here. The area where you stick the introduce the cuff into is up top here. On the bottom is where you can put the AC adapter, which was not included as part of this. That's something optional that we may get later. And on the side is where you can put the SD card. Okay, so it came with 6 or 7 cuffs. These are the ones we use most frequently, so these are the ones that I'll have out and available in the bag. And you can also see the hose, the extender hose. So if we need to have it longer to get blood pressure more frequently on a patient in the cage, we can do that. And then as always, we have our little stickers. Okay, so I'm going to go ahead and turn this on. And this is the first view that you're going to see. And I'm going to go ahead and attach one of these. Okay. And I'm going to use my own pen so that I can get some readings to show you. So this is the button that you're going to use to start and stop the air going into the cuff. And also, just move my finger out of the way here. This is what's going to allow you to have your map show. So it's off right now. You want to at least click it once so that it'll say stat. You can click it multiple times though to remind you to check the BP in intervals of up to 30 minutes. So there's, 1 minute, 2 minutes. I think when you get to 5, it starts to go in intervals of 5 minutes. Okay. And then it goes back to off. And if you have it on, a certain time and you want it to go back to off, you should just be able to press and hold. There. These low and high alarms are used to indicate the blood pressure, so you can have it tell you when it's too high or too low. It's not something that you have to have on though in order for this to function. So we're going to turn those off. And I am going to change that to stat. Okay, so all I have to do now, if this was my patient, my cuff is already on my patient. And I'm going to hit go. So it makes that little trilling noise. And then it does the same clicking that the last machine did. And then everything comes up here. So this is your systolic, your diastolic, your MAP, and your heart rate. So it kind of goes actually right in order of everything that we have listed out here, which is great. And then it even tells you right away it's time to start a new BP. So we're going to go ahead and do it one more time. Okay, and so now since I've done 2, you can actually see the averages that are starting to show up. So this is the average systolic, this is the average diastolic, and this is the average heart rate. I would not count any of these as accurate for my own self because I do not have this cuff positioned properly at all. I am a human, this is not a cattail, but just to give you an idea. Okay, one thing I did want to show you, and I am going to set this like this for a second. Ooh, that's not going to work. Okay. Sorry. I'm going to undo this. Sorry, this is a little all over the place. In case you were not aware, this optimum zone, you want that to meet up. Let's see if I can get this in a, there we go. So you want this line here to be somewhere in between these two lines. Okay, that's how you know that it's on your patient properly when you put that on. So that line should line up in between these two lines. Okay, if that makes sense. And if not, please let me know. All right, and the other thing that you'll probably want to know, so you do have your battery reader here. This does take 4 AA batteries. Okay, so just be aware of that. If it is getting low on batteries, just go ahead and change them out. And I'm gonna stop this now, and then I'll show you how to add, actually first, let me go ahead and show you this. So the SD card goes right in here if you don't throw it. Okay, and it clicks in just like in a camera, and you can hit save screen, and it's saved it now as a JPEG on this SD card. Okay, and there is a way to get it to consecutively save screens within a certain time interval, but I don't think that's a function that we're going to need as of yet, so do not worry about that. I'm going to turn this off, and then I'll show you how to upload the JPEG.